Hello, I'm Dr. John McClanahan, and I'm an addiction counselor in Annapolis, Maryland. I'm also a grateful recovering alcoholic. I want to welcome everyone to our next presentation in our sequence that deals with education in alcoholism and other drug addiction. Today we're going to take a look at a couple of parts of dealing with blood alcohol level and behavioral effects or behavioral aspects. The first segment we're going to take a look at, I'm going to talk about some of the misconceptions, the myths, some of the just bad information that surrounds where that number comes from, what creates that number, how large of an amount of alcohol this number represents, which is a huge misconception. And then talk about, again, where the idea and the number comes from. There's a formula that generates this. And then we're going to do a few examples of that number. I also, in the second segment, we're going to talk about the 5 things that are very common that cause blood alcohol level to rise, and the 2 things that actually have an impact on how quickly it drops, and a whole lot of myths around that. In the final segment, we're going to take a look at a chart that deals with comparing 2 people. One is a social drinker, one is an alcoholic, and we'll show the purpose of that when we get to that. One of the things that I do when we talk about this, I do this presentation in my education groups and occasionally in a treatment group as well. I want people to have an understanding from the very beginning, I guess. This number for years has represented a legal situation, but this number has a lot of other value and uses as well. It's not just a legal snare, and above a certain level, they've got you, and you end up having to deal with whatever consequences your particular area requires as a result of a DUI or a DWI. But there's also a lot of clinical value and a lot of diagnostic value as well. So it has some other uses that you may not be aware of, and I'll bring those to you here as we go through this. I always like to start off with probably one of the biggest misconceptions about what blood alcohol level and that number actually means and represents. I always ask if anybody who's present has ever had their blood alcohol level measured, either as a result of some legal intervention or maybe in a treatment situation as a result of a hospitalization or an inpatient stay. And I'll ask for people just to kind of give me some examples of that number. And I always tell people as well, if you want to do I have a friend who, you certainly can do that as well. We'll start off with the 2 standards, okay? Most people are very familiar with the old gold standard, 0.1, anything above that in the state of Maryland and in most states, that was considered the legal cutoff limit for a DWI. Several years ago, that limit dropped to an 0.8. And has been that way for a number of years now, and is in a lot of states, if not most states in the country now. So again, I always ask if anybody wants to just kind of volunteer their number. And I don't do this to embarrass anybody. I don't do this to put anybody on the spot. I just use it as a point of reference as we go through some of these things. So anybody remember what their blood alcohol level may have been at one particular time or another?
0.17.
Okay. 0.17?
0.16.
Okay. Anything else?
0.19.
Okay. I also very often will hear the usual spread, 0.1, 0.11, 0.14. This number we'll come back to in a second. I always put a number up, and I use this sometimes as a hook. We do this over the course of a couple of sessions in the education program. I'm going to talk later on in the final segment about a patient that I had a number of years ago, and very unique situation, very unique story. Most people look at that number, and just the number itself is pretty unique, but the situation that surrounded it shows that nothing's etched in stone. Okay. Where this number comes from, and again, I've done this for a long, long time in a lot of different variations, a lot of different scenarios. I'll do it in group. I'll do it in sessions. I'll do it in treatment. I'll do it in education. I also, for years, did a number of presentations for the general public that dealt with this number, especially school groups, PTA meetings, community groups, people that wanted to have some understanding about blood alcohol level, especially around prom time or graduation time, where you'd have a little higher occurrence of drinking episodes. And so often I hear patients and clients make this comment, and I understand why, because the general public makes these comments as well. People for years have misinterpreted what that number actually represents. I've had people look at the old standard and say, well, geez, if 10% of a person's blood is alcohol, they should be arrested. If 52% of a person's blood is out, they ought to be dead, and kind of on and on and on. That number does not represent that large of an amount. Okay, there's a formula that this is plugged into, and I'll show you that here in a few minutes. But again, like I said, people for years have talked about this number represents a larger amount. Very often I'll hear people that'll come in and they'll mention how much they had to drink, and did they do a breathalyzer? Yeah, and there had to be something wrong with the machine because I had XYZ to drink and I blew a 1.9, and there's no way in the world that 19% of my blood was alcohol, and that kind of. Again, that's not what that number represents. Okay? It's a much smaller amount than that. Just to show you as a little visual example. Hopefully you can see this, and I use this as a prop in the education groups. When somebody says, I couldn't possibly drink enough to get my blood alcohol level to 0.8, to the legal limit, if this amount of water in this measuring cup was alcohol, that's a DWI in the state of Maryland. And in most states, again, that have 0.8 as a limit. Well, most people, if I pass this around and they look at it, they're very often very surprised that it's not a whole lot. Now, to give you an idea, somebody always says, well, I don't drink, gin, and I don't. There's the same amount of alcohol in a 12-ounce beer that you find in about a 3-4 ounce glass of wine that you'd find in a shot glass of bourbon or whatever. So again, the amount of alcohol in those drinks is approximately the same. But again, if we're talking about just alcohol as a substance, this is a DWI, and most people certainly could drink that much alcohol in one sitting over the course of a couple of hours. So I want you to kind of keep this visual in mind as we go through this. Again, when people look at this number and say, I couldn't possibly drink enough, okay, where this number comes from is actually, it's a mathematical formula. It's not just a number they pulled out of the air. It's not just something they said, well, this will work and this will get them. There actually is some science behind this. What this number means, okay, that number represents parts of alcohol per 10,000 parts of blood, okay? So you have a fraction, you have a ratio that this represents, okay? Take our old standard, and we can do this with any number. When somebody says, I couldn't possibly drink, again, and you'll hear me mention that over and over again, I couldn't possibly drink enough to have 10% of my blood be alcohol. That's not what that number represents. Plug in the formula. Okay? A blood alcohol level of 0.1 is 10 parts of alcohol per 10,000 parts of blood. If you reduce that down to its lowest value, it's 1/10 of 1%. It's not 10% of anything. It's 1/10 of 1. Okay? So right away you can start to see that this is a much smaller amount than people think. When somebody says 10%, you're right, you couldn't. There's no way in the world you could drink that much. When somebody said, could you drink 1/10 of 1%? Well, all of a sudden, about what I had in that little measuring cup, that's what you're looking at, is an 0.8, in that range. So you certainly could. To show you, give you a quick example, I had a client a number of years ago, to show you how important that little decimal point is. She was getting ready to go to court. She'd gotten a DWI in a neighboring state here. And she went to court and had come in proactively, was involved in the education groups and doing the things she needed to do prior to going to court. She goes to court and she comes back after her hearing the following Saturday. She was in my Saturday morning group. Well, everybody before group started was kind of just making small talk and asked her, how did it go? And she said, I got to tell you, you're not going to believe what happened. Well, that could either go, it could be good or could have been really bad. She said, no. She said it was the most bizarre thing. She said, I'm watching all the cases before me, and the judge is just hammering everybody. And she said, I am really nervous. First offense, way out of character for her. She said, I'm really starting to sweat. And they call our case, and my attorney and I go up to the defense table, and we sit down, and the judge is looking at my folder, and he looks over, and the arresting officer was in the courtroom as well, and he looked over and said, Officer Jones or whoever, is this your report? And he said, can I approach the bench? And he looks, he goes, well, yes, Your Honor, it is. And he said, okay. He said, is this your signature? He said, Your Honor, you know it is. I've been in front of you a zillion times. You know this is. He goes, okay. He said, and this is your report and you're sticking to it. Well, yes, sir. Okay. And the officer goes and steps back, and the judge looked up at the young woman and said, ma'am, would you please stand? And she's going, oh my God, they're not even going to, I'm doomed before I even get to say my piece here. And he said, this is the luckiest day in your life. Case dismissed. And she looked at her attorney and said, what happened? He said, I don't know, but let's get the hell out of here before they... Well, afterwards, they're standing outside, and court had taken a recess, and the state's attorney was out in the hall, and her attorney asked him, what just happened in there? And he said, I tell you, he said, it was a technicality. He said, it's one of the most bizarre things I've ever seen. When she was arrested and they did a breathalyzer, she blew a .15. When the officer wrote it down, he accidentally put the decimal point in the wrong spot, and it made it look like she had blown a 1.5. The judge said, my hands are tied. You can't possibly, feasibly do that. So she was released on a technicality. So that little decimal point carries a lot of weight. So anyway, this is what we're looking at. We're talking about a very small amount of something. Okay? Go to my guy that we're going to talk about later on, my 5'2" guy. You can plug him into that same formula. Okay? 0.52 is 52 parts of alcohol per 10,000 parts of blood. And I always tell my folks, I promise this is the only math you're ever going to have to do in here. If you reduce that down, what you basically have is 0.5 of 1%, and you can reduce that down one more step. That number actually represents 1/2 of 1%. Okay, now that's still a lot of alcohol on board, but it's a far cry from 52% of a whole to 1/2, 50% of one. Okay, that's still a lot of alcohol, but again, it's certainly not as large of an amount as people think that represents. I'd mentioned in one of the other little segments we had done dealing with medical aspects, pardon me, that one of the things that I had a real thrill doing years ago was I was a principal lecturer in substance abuse for the National Museum of Health and Medicine. And I used to do a lot of lectures and presentations for school groups when they would come in to take tours and that type of thing. And I would love working with the kids because it always kind of kept me on my toes. I had to come up with ways to present information that would keep their attention, something that wasn't too involved. So I would come up with these kind of wacky things to get the point across. Well, for kids, like I had mentioned in that one segment, there's nothing any more frustrating than going on a field trip. You're away from school for the day, and then you find out you got to learn something. And especially when we start talking about math, that really just was kind of the ultimate. So I came up with another way to show this, how it's very easy to hide a large amount of something in a very small amount of something. I had told them, take point one, okay? Suppose we're going to do a little experiment, okay? And we were going to visually show how easy it is to hide a small amount in a larger amount, okay? Which is what this is representing, a small amount of something in a large amount of something. I told them, now suppose we wanted to visually represent a blood alcohol level of 0.1. What we would need to do, suppose we had 10,000 plastic milk jugs, just the kind you get at the grocery store. Okay? So we had 10,000 of these empty jugs. We had the availability, we had the space to do this, and we wanted to do an experiment to see how hard or easy was this to hide that amount of alcohol in that amount of blood. So what I told the kids we would do, we would take those 10,000 jugs, and a blood alcohol level of 0.1, you would have 10 of those jugs would be full of alcohol. The other 9,990 would be full of blood. So now they could start to get kind of a visual picture of a small amount and a large amount. And then I told them, suppose we took them outside, big parking lot at the museum, and we had the ability to line these up. Okay. And I told them, use your imagination. I'm not going to put 10,000 little squiggles up there. But suppose we had 10 rows of 1,000 each of these milk jugs. Okay. 10 are full of alcohol, 9,990 are full of blood. Now, what we're going to do is we're going to time people to see how hard it is to find these jugs of alcohol hidden in the jugs of blood. Okay? Now, suppose our first couple of passes with this experiment, we've made it fairly simple because we're not thinking about this at the time. Suppose we put one jug of alcohol in the front of each row. Okay? And now we have our subject pool. We could do it here. Okay? A lot of times around lunchtime, people at the neighboring buildings will walk through the parking lot here to go to the grocery store up the street and get something for lunch, and then they walk back through. So we kind of have a built-in subject pool. Suppose people start coming to go to lunch, and we decide what we're going to do. We're going to pay each person $20 if they can find all 10 jugs of alcohol in our mess that we've got out here in the parking lot. And to be fair, we show them what one looks like. Here's a a jug of alcohol. Here's a jug of blood. This is what we're looking for. Okay? And we tell them, now go ahead and do your best. Well, that first person walks down the rows and goes, well, there's one, there's one, there's one. There's one. Hell, this is easy. There's one, there's one, there's one, there's one. They get to the end of the line, and we've got somebody with a stopwatch and a clipboard, and they've timed the person and said, well, you found all 10 in 6 seconds. That's fantastic. Here's your $20. Thanks for participating. Next person comes along, you want to make $20 really easy? And, oh, sure. And we explain the whole situation to them. Well, there's one, there's one, there's one, there's one. They get down to the end of the row, and the person holding the stopwatch goes, "That's fantastic. That was 3.5 seconds. That was fantastic. Here's your $20. Well, suppose this goes on and on and on and on for a while. Now we start to realize we're going to run out of money really soon, and we haven't proved anything. These people are figuring this out way too quick, way too soon. The average is, 2-3 seconds. Okay, we got to make it a little more difficult. So what we decide to do is we take the jugs of alcohol and we randomly place them in the rows, just like an Easter egg hunt. Okay, maybe we got one in the front of this row, one in the back of that row, none in that row at all, maybe one in the middle of that row, none here, and just kind of so on and so on. So they're randomly scattered in those rows. Well, now by this point, the people who were our first couple of subjects have probably gotten their lunch, gone back to work, gone to their office mates, and said, "You want to make $20 really quick? These morons down the street are handing away $20 bills like nothing. It's very simple. All you got to do is, they're right there." Well, now all of a sudden we got a zillion people that want to participate in this, and we tell them the same rules. Okay? Want you to find, if you can find all 10, we'll give you your $20. Okay? And the person says, "Well, this is going to be easy. You might as well give me my $20 now." Okay? There's one. There. Oh, it's not there. Now they're going to have to walk up and down each row and visually spot each one of the jugs of alcohol. Now they're going to get to the end of the line, and the person with the stopwatch says, the average has been 3.5 seconds. That took you 5 minutes. Okay. Here's your $20. Okay. It's kind of a corny example, but I think, again, it shows or would show the kids it's very easy to hide a small amount of something in a large amount of something. So again, when people say, "I couldn't possibly drink enough to get my blood alcohol level to be 10%, 50%, whatever it might be," they're absolutely right. They couldn't. We're not talking about that large of an amount. Okay? One of the things that I always point out at this point, when somebody says, again, "It couldn't happen," it's got to be something wrong with the equipment and that type of thing, I put a little arrow next to this one here. Okay? Over the last 20, 25 years, about 80% of the DWIs handed out nationwide. This is the average. This is what we see. I've been doing this for almost 30 years, and I can tell you that's one of the things that I've seen that average as well. So again, when somebody says, "I couldn't possibly drink enough to get to the legal limit," the old one or the new one, okay, but we certainly can drink enough that this is the average. So somewhere along the way, we lose track. Most people, again, there's an old adage about most people lose track of how many they've had after they've had a couple. Okay. I think we had mentioned in the medical aspects when we did your brain on drugs, I had mentioned that there was a beer distributor that for years, a manufacturer, a brewery, that for years one of their taglines at the end of their ads was "know when to say when." Well, the problem is the first part of the brain that gets knocked offline is the part that controls reason and judgment, and that's what tells us when is. So somewhere along the way, when got lost in the shuffle. If that's the legal limit and that's the average, about 80% of the DWIs handed out nationwide are twice the legal limit. In fact, in California, for years, it was higher than that. So again, when somebody says, "I couldn't possibly do that to get to that level," very often we find ourselves at a higher level than we ever imagined. It doesn't take much to create a major, major issue. One of the things that we're going to look at in the last segment later on, when I talk and compare two people, the social drinker and the alcoholic, one of the things that we're going to look at is performance. Like I said earlier, that the kind of the title and topic of this is blood alcohol level and behavioral effects. One of the things that I ask when people come in to do an evaluation or do an intake or whatever, I'll ask if it's DWI related in particular. I'll ask if it's treatment related also, but not for the same reasons, because we know where the person is at that point. I'll ask, at the time of the arrest, did they do a breathalyzer? And if they did, do you remember what the number was? And I ask people for two reasons, and I tell them it's not because I'm being nosy, it's not because I want to embarrass you because it was higher than you thought and that type of thing. I'll ask them for two reasons, like I said. One, in the state of Maryland and in most states, there's a cutoff limit in terms of person coming to treatment and group and that type of thing. Above a certain blood alcohol level is a determiner for whether the person does 6 weeks of education, 12, 26, needs to go into treatment, whatever. So we use that as a diagnostic type of thing. But I also want to find out how the person was performing at the time of the arrest. Okay. And at a certain blood alcohol level, because again, that gives a lot of window into, is it more of a problem than the individual might believe? One of the things that you see very often, and I'm certainly not making fun of anybody I see in any of the sessions I do, because I certainly, like I mentioned, I'm in recovery and I've been there too. One of the things that you see every so often in a treatment group, I'll do a version of this just as a reminder for the individual. And I'll ask anybody in here remember their blood alcohol level. You know, was it taken on the side of the road, in the hospital, whatever your situation is. You'd be amazed at the difference and the spread of the numbers that I get in treatment groups where addiction is an issue, alcoholism is an issue. You'll see very often numbers, 2.3, 2.5, 3.1, okay? Whole different level of numbers represented. When we talk in the next segment, when we talk about some of the factors that cause blood alcohol level to rise, we'll talk about that very thing and that difference. And then in the third segment later on, you'll see it spelled out when we compare, again, the social drinker and the alcoholic. I'm going to end this piece right here. It's kind of a short intro. And then in the second segment, again, we'll look at the 5 ways that are very common that influence how quickly it rises, and 2 of the ways that, actually the only 2 ways that cause blood alcohol level to drop. And there's loads and loads of myths and bad information that surround that. So we'll come back in a few and we'll pick up with that. Thanks.